Good morning everyone again, and sorry for being delayed. Okay, so today I think this chapter I did 2 or 3 years back in Dubai. Okay, and this is second I'm speaking about the Dubai local chapter. Okay, this is about dental CDT was Abu Dhabi, and here we're using the CDA codes. So I'll be covering both, and I'll be giving touch over the guidelines for the Dubai dental coding and Abu Dhabi also. Okay, so today our content is about the introduction elements of dental claims. Okay, then the dental common problems and the code we are using. Then the dental terminology, okay, anatomy and dentition. Then about the Dubai DHA guidelines and claim protocol, and sometime about the Abu Dhabi hard guideline and protocols. Elements of dental documentation, then procedures, the codes we are using in Dubai and also in Abu Dhabi. Then some abbreviation what we are using in our documentation, and about the audits, and some about the update about the scope of service and the audits. Okay, so dentistry is defined as evaluation, diagnosis, prevention, and treatment. Okay, so that includes non-surgical, and especially the dental is coming in the OP. Okay, and some maxillofacial, and these are under inpatient or some in the day case. Okay, there are branches of dentistry. They are different specialty in dentistry, like orthodontic, prosthodontic, periodentistry, then prevention, periodontic. So there are multiple specialty under dental also. And also they're using for the oropathology, forensic dentistry, oral medicine, and community dentistry. Okay, the elements of the dental claims. In the dental claim, we need to have the diagnostic code, then the procedure code, tooth number, and in some cases we need the authorization details in the claim when we are submitting to the insurance company. So these are the basically I just choose the 13 common oral dental problems. So we have gingivitis, accretion, caries, bad smell, infection, loss of teeth, so crooked teeth, crowding. So these are basically 13 main problem which when the patient is coming. So you will find most of the encounters for dental under these 13 categories. Okay, let's talk about the dental anatomy. So why it is important for a coder to know the dental anatomy? Because if you see the ICD-10 codes, even the procedure codes, those all are related to the anatomy. You have to know the, for example, you have caries. So you need to know the depth of dental caries. Okay, if there is one problem, you have to know those terminologies and this anatomy also. For dental, for example, if you are talking about dental caries, a lot most of patient in all dental clinic, you will have caries thing. Okay, so why it is important to know the depth and the tooth anatomy? Because according to that you will assign the code. For example, you have dental caries. Okay, you cannot doctor cannot only write patient has dental caries. He need to specify the depth and surface of caries. And how you know, if you will even sometimes in X-ray you can see also. Okay, and if you see this diagram, you have for example the there is first enamel surface, okay, then dentine, then pulp. So if you see the ICD codes and the procedure code for restoration, you will find this again, how many services doctor has done the restoration and where is the patient has the caries. So you have to know the tooth anatomy itself. Okay, another thing again for the claim and for the coding, we have to know the type of dentition. So we have two type of dentition for the adult and for the pediatric. Okay, so because it's different tooth numbering, okay, you have to know, because even again, if you talk about the restoration codes, you have different codes for the pediatric, okay, and different for the adult. Okay, so see, this is the first one. This is a primary tooth. Okay, so you will find this tooth numbering for this one alphabetical. Okay, A, B, C, okay, this one. And for the adult, you will find from 1 to 32. Okay, and again because once doctor will write the chart, and of course the registration, they will put the date of birth for the patient. Okay, from there also you like sometimes you can know that this is like patient will have more pediatric teeth or no. If you see, for example, this one, the pediatric teeth, okay, so 8 to 12 months, these are erupting the incisors. Then if you see like different teeth are erupting on different ages. So this is important to know also. Like for example, if patient is 2 or 3 year or 4 year old, okay, you cannot assign the like permanent teeth or you cannot put tooth number for the permanent. So these are tooth numbers for the pediatrics, see, from A to T. Okay, so make sure you are writing the, like doctor is writing the correct tooth numbering, and once you are assigning the code, procedure code, you have to give the correct tooth number in your claim. Okay, so this is the like all the setup we are using the universal tooth number. Okay, so when doctor put the documentation, he need to write correct number tooth numbering for the adult also. So basically they are using here universal tooth numbering. Okay, before they were like multiple FDI and Palmer, but now only universal tooth number. Okay, everyone is using. Sometimes what's happening in the mixed dentition, you will find both the like this one, the adult tooth numbering, and also for the pediatric. Okay, so that in that cases you have to be careful when doctor document, because when the, for example, the patient is age of like, for example, 10, 12, 13 like this, you will find multiple dentition. Okay, and also for when doctor is billing the examination, that time he has to assign the correct examination code. Also we have sorry, for the examination also we have for when they're doing the full mouth examination, we have different code for the pediatric, different for the adult, and for mixed dentition there is different examination code. So that's also you need to be careful when you assign it, because once like you will have the audit and this thing, they will look on those things. Okay, so these are like supernumerary tooth. Okay, so as I said, for the pediatric we have from A to T, and for the adult we have from 1 to 32. Okay, so sometimes what's happening, like there are like some extra teeth, or some patient they are having extra teeth. Okay, that time you have to assign this tooth number for the supernumerary tooth. Okay, again we are talking about, as I said before, like we have to know the tooth surfaces. Okay, so if you see this diagram on the left side, this one, okay, so we have multiple surfaces tooth. Okay, so again, for example, doctor is assigning in the documentation, he is writing like patient has dental caries into facial, buccal, mesial, so 3 surface, right? So if the doctor is going to remove this caries in the restoration, the procedure code also in the notes he need to write also like he has restored 3 surfaces, and he need to mention that like surface name also. Okay, so in case like for the like complete documentation, he need to specify the surface name, tooth number. Okay, so also like and the material they are using for the restoration, and they don't need to even if they write the like abbreviation also. For example, for the mesial he write M only, okay, occlusal O, so that is also acceptable. Okay, so DOH and DHA, dental coding and education rules. Okay, so coding for the healthcare products and service shall in accordance with the dental CDT rules for Dubai. Okay, so they are using American coding in Dubai. Okay, that is also called CDT. Okay, concurrent dental terminology. Okay, which is established by the ADA, American Dental Association. Okay, and in Abu Dhabi, okay, they are using the USC and LS codes. Okay, those are excellent. The Canadian dental coding. Okay, so like especially when the new coders they are joining, they have to be aware about this thing, like in what code we have to use. Okay, in Dubai they have American dental coding. In Abu Dhabi, in Al Ain, we have Canadian dental coding. So they are totally different codes. Okay, about the claim methodology. So type of encounter is, as I said before, like it is outpatient, okay, dental treatment. So we have diagnostic dental treatment, preventive and restorative. and routine periodontitis, prosthodontic, and also like orthodontic, of course. And sometimes we are having, like, for example, for pediatric or some special need patient, like some cases they refer to the daycare dental. And of course, for the traumatic in this one, also like sometimes they need the IP dental surgeries. Okay, so this is the most important part of this presentation, the documentation. So element of the dental documentation. So we need doctor need to write the chief complaint. Okay, history of present illness. So this is not like in the medical we are having an E&M code. Okay, where we require all this like history, past and family history, all this. Okay, but in dental charting also it is better to have all these details. Okay, especially the past history in the family. Okay, so they didn't only even they write in one word, there'll be also enough. For example, the mother is diabetic or something. Okay, only in when the patient is visiting first time, when the doctor is doing the full mouth examination, there is a time they need to fill this part, the past history and the family and social history. Okay, so chief complaint, history of present illness. Okay, so again, the chief complaint also why it matters. For example, doctor, patient is coming with severe pain or any trauma. Okay, so if chief complaint is, he clearly mentioned that patient came with a severe bleeding or severe pain. So according to that one, the coder will assign the dental examination code. We have, because for the emergency examination, we have different code for the examination. Then the history of present illness, past and medical history, social history. Okay, so this is the part where the dental dental examination and charting. So here we have the intraoral examination, where doctor will write whatever he find in patient complaining for. So when doctor will do examination, whatever he find, for example, he has broken tooth or he has missing tooth. So in this part, intraoral examination, doctor need to specify everything, whatever during his examination he find. Then again, extraoral examination, he has any redness or swelling, so he need to write in this part. Then the hard tissue examination. Hard tissue, of course, it is like bone or the tooth. And soft tissue, it is like your gum or tongue or lips. This all includes in the soft tissue. Okay, the next thing is the radiograph findings. So I have the slides for this one. So when a doctor is taking any X-ray, so he must write the findings. Sometimes even there is no abnormal finding, even then he need to write the there is no abnormal findings. For example, patient is coming with the pain, and doctors want to take the bite wings. In that case, so maybe when he took the X-ray is fine. There is nothing wrong. Only maybe for something he has pain. Okay, so in that case, doctor will write that bite wing taken for this and this teeth, and there is no abnormal finding. So this word he need to write, even there is no finding. Then the procedure details, again, the detailed procedure note we need to have in the notes. So for example, what technique he has used, what instrument he has used, anesthesia is given or not. So all these details need to be in the procedure note with the correct tooth numbering. Then, of course, the counseling and patient education. For example, the doctor is giving the oral hygiene instructions, and for example, after the extraction, they are telling when to eat, okay, and what to eat. So all these things, it need to be in the education part. Then, of course, the follow-up instructions. Okay, about dental chart and most common use abbreviations. Okay, again, as I mentioned before, before we have some abbreviations about the tooth surface. So now they can use this for the arches. For example, upper arch, he can use UA, lower arch, LA, then the quadrant, UL, then the upper left, upper right, upper, all this he can use. But this is acceptable in the documentation. Okay, the prophylaxis is about the scaling, polishing, oral hygiene instructions. Okay, so these things they can use in abbreviation. Then about the dental charting, this is again very interesting part in the dental documentation. This also helps, of course, when doctor is billing the full mouth examination, okay, they must have this one. But even they don't have full mouth, still they can keep this one. This is really helping doctor a lot in the for the future treatment. So even from this diagram, they will know which tooth is extracted, which has RCT, which has caries, everything from this charting. In the next visit, when the patient is coming, from this one picture, doctor can know that where the problem is and what is happening with all the teeth. So this charting is very important point. Like some doctors, they are maintaining very nice documentation for the charting. So next visit, they just need to open one chart and they will know everything about what's happening with the teeth. They no need to like read all documentation. Even this will help. Sorry. Okay, so this again, in the previous slide also have same picture. So see, this is again for the documentation. Okay, so see, these are the like two surfaces named distal, mesial. So this one again for the diagnostic part and for the procedure, both we need to have the. For example, doctor is documenting patient has caries, so he need to specify patient has caries in tooth number 8 on mesial, distal, lingual. Okay, so from that part we know already that okay, doctor is going to restore 3 surface. Then the procedure code we have for 3 surface. Okay, then of course doctor will write again the same thing in the notes also. Okay, now let's talk about the ICD-10 codes. So diseases and disorder of the oral cavity, visual vision and adjacent structures. So we have the like K series code. ICD-10, like Abu Dhabi and of course in Dubai, both they are same. Like ICD-10, there is no difference. Only both are using the same ICD-10. Okay, so we have the most of the codes you will find in the K series. Okay, even for the caries, for gingivitis, for gum diseases, all this, most of codes you will find in the K series. If you see here, dental caries K02, okay, about the gingiva and the periodontal disease K05, okay. So, and for example, for the missing teeth, okay, or pug-related K04. Okay, sorry for this. Is like I copy paste this one from the Excel, so it is very. So these are like most common used K series codes. For example, caries or impacted tooth, okay, or the accretion, gingivitis. So this is the category of K series codes. Okay, and also we have like M series code. So M series is about the maxillofacial. Okay, and mostly in the prosthodontic we are using this course. Or patient is having any like TMJ problem. So these all are coming under the M series code. For example, malocclusion, you have M26 series, M26.211 for the class 1. Okay, so these are the M series codes. And yes, S series code, same like in the medical we are having fractures and trauma and like those things. So we have in dental also very rare, like for example, if the patient is coming with the broken tooth, so we have this like S series code, S02.5XX, for example, for the fracture of dental. Okay, so this code is like like most of the coders, they are confused with this code and with the crack and with the fracture restoration. Okay, this code, if you can see this code in the presentation, is it clear? So this code basically S02, fracture of tooth traumatic. So in this senses is, so some coders what they taking, they think that if there is trauma, then only they can assign this code. So it's not like that. So whenever patient has broken tooth, maybe he's eating any hard food or he's opening any bottle or something, anything, and a tooth got broken, so you can assign this code S02.5XXA. And of course, when you are assigning the like this S series code, you need to also add the external cause of injury. For example, patient fell down and he got tooth fracture. So you will assign this code S02 and plus the W series. For example, for fall we have, for example, W9 XXXA. So we have to use this code. So according to that external cause, you have to assign the code. Maybe patient has car accident, maybe he fall down on a bicycle. So according to that condition, you need to assign the code. Okay, then also we have some of the Z series code about the examinations and like for the, so these are mostly use the Z series code. For example, so again, as I mentioned in the earlier slides, like chief complaint. So this is very important. When the patient he just come and he want just check up only. Okay, he don't know, he just want check up. Okay, so that time you will assign this code, either this one or either this one, Z series. Okay, so why it is important about this code? So if you see this first code, it is about without abdominal finding. So what happened here, like for maybe patient is coming for checkup. Okay, doctor did the checkup and he don't find anything. He said everything is fine. Just do the regular brushing and everything is fine. So there's a time you will assign this ICD code. Then again, if the patient got examined, okay, but his chief complaint was dental checkup. But during examination, doctor find, okay, this tooth has caries and this is missing, need an implant. So again, chief complaint will be the same, dental checkup. And down in the intraoral examination, doctor will write whatever he find during examination. Maybe he found patient has caries, okay, he has cracked tooth, he has like gingivitis. So all these things will be under intraoral examination. But the chief complaint will be again same, dental checkup. Okay, then you can assign this code. Okay, then we have like aftercare code, this one, when patient is having any surgical, for example, surgical extractions or like implant something. So then you can assign this code for the when patient is coming for the follow-up. Okay, then we have the status codes for dental restoration and sealants. Okay, this code Z98.11, no need to assign this code if patient already have like other code. For example, patient has a fracture restoration. Okay, so fracture restoration itself, it's saying that patient has already like before he has restoration, like he did filling. So that time no need to assign this code. Only that K series code K08.531 or 530, those code will itself saying that patient has restoration. So no need to assign this one. Okay, so now the this three codes, suture removal. Okay, so if the patient is coming after the surgery, for example, after the implant or any surgical extractions, patient is coming for suture removal. So again, this is same code what the medical they are using, so same code. Then we have the encounter for fitting adjustment of the prosthetic device. So this is code basically when you're using, like patient, maybe patient is coming with any like any loose crown or the loose bridge. So see, encounter for fitting and adjustment. So if the patient already have like that prosthetic device, so now he's coming for adjustment or fitting only. So that time you can use this code. And same for the orthodontic Z46.4. Patient is having any braces or any like appliances. So he's coming this visit. He is only for like for loose appliance or something. So doctor is going to fit or adjust that one or recement. So you can use this code. Especially for recementations, this code is supporting. Okay, if you see the right side, these are the new codes. Okay, for the risk of caries. Okay, so when this is all mostly for the pediatric patients when like they have the milky teeth and okay, so they are not brushing more, so they have risk of caries. So doctor can assign these codes, risk of caries code. So see if you see that there is low, okay, moderate, and the high, like high risk of caries. So this what I was talking about in the previous slide. Okay, so fracture. So see if patient is coming with a fracture restoration. Okay, fracture filling or even for the broken appliance, something you can assign one of these code. Okay. Okay, again, now this is like very important to know about these first three codes. See, so all are fracture restoration. Okay, so see, fracture restoration without loss of material. This is with loss of material, and this is unspecified. Okay, so mostly like code they're using the first two codes, without loss or with loss. Okay, so how you can take this code is, for example, patient is coming with the like for example broken crown. Okay, broken crown, for example. So if he lost that crown, okay, so then that time you can use this one. So doctor will document that patient lost his crown. Okay, this is what he will document. So the code you will assign is this one: fracture restoration with loss of material. And if patient is coming just with the broken filling is still there, then you can assign this code 530. Okay, so if you see now about the fracture tooth, this is what I mentioned in the previous slide. Okay, so if patient coming with a fracture tooth, you will assign this code S0215XXA. So this is fracture tooth, initial encounter, close fracture. Okay, sometime when the patient is having any trauma, so like tooth is like getting like dislocation. Okay, so that time you can assign this code S03.2XXA. And again, if you see this blue area, so I mentioned here. So if external cause of injuries codes you have to assign also. Then the last code is crack. Okay, so again, as I mentioned before, some coders are like coders and even doctors, because I think doctors are the one putting the codes and then coders are verifying. So what is happening here is doctor will document crack tooth, okay, crack tooth, but the code he's putting is this one, okay, S code, okay. So what will happen? Okay, so like for example, you have audit, so auditor will see this one, he will say, okay, this is crack. So he need to assign the correct code. Okay, if doctor document crack, you need to put this crack. Okay, so in the X-ray, for example, if he will see the X-ray or something, so see crack is like same like when you have crack in the mirror or crack in the wall. So it is the same like that. Okay, so broken is like when the totally part is like gone or this one. So this is how like you can define this one. Okay, so these are the codes in the way we are using for like American dental codes. Okay, so what is difference? The main difference is first thing you will find in the American dental code is D. You will find the D in the beginning of all the codes. Okay, so see for the diagnostic we have D 0100 to D 0999. Okay, then again for preventive 1000 to 1999. Restorative we have 2 series, then endodontic 3 series, periodontic 4 series, prosthodontic removable 5 series. Okay, oral and prosthetic 59. Okay, so this all are like according to the specialty. So same thing here in Abu Dhabi, we have like, so here what is the difference again? We don't have D. Okay, if you see here, we have D and we have 4 digit. Okay, and here we have 5 digit codes in Abu Dhabi. So if you see again the same categories, if you see here diagnostic, okay, here diagnostic also, so same this one, same specialty. So for diagnosis here we have in Abu Dhabi from 1000 to 0, this one 9000 series. Okay, then 10,000 series for prevention, 2,000 for the 20,000 for the restoration, 30,000 for endodontic. So all this one for as per specialty you will assign the codes. Okay, so the component of dental procedure, okay, in the way every dental procedure lists code must have the first 2 of the following 3 component. The reference to 5 is pertain to the code of printed in the CDT manual. So see this one, procedure code, a 5-character alphanumeric code beginning with the letter D. Okay, this is all I mentioned before. So you will find D in all the codes. Each procedure code is printed in the boldface type. Okay, so all will be like boldface. A procedure code cannot be changed or abbreviation by any license or any printed form. Okay, so those whatever codes you have in the book, once your software team they are adding in your software, so make sure it is same description, same code, even no dot, no like extra thing should be in the code and in description also. Okay, so again same thing. Okay, 5-digit codes and with the D. So this is one of the example for the radiograph. Okay, so we have D0210 for the inter exam. Okay, for the CDA course, so we have the unit of time and the letter following procedure must come from the following, where the L letter follow the procedure of laboratory procedures, unit of time. Okay, so again in dental we are having, for example, for restoration course, okay, if the last digit is 2, 1, 2, 3, 4, so this will show us the like number of services. And some code we are having like 111, 112, 119 for this one for scaling portion, for example. So in the Canadian codes, we are having some codes with the time-based, okay, time-based codes. Okay, it's mostly like common use codes are like scaling, polishing, route planning, these codes. So what is important in those codes is you need to document the start and end time for the services. Okay, about evaluation codes. Okay, so for dental examination code for the Dubai. So these are, for example, examination code common use. Okay, D0120 to D0160. Okay, in the Abu Dhabi, we are having these codes. So if you see difference between this and the way in Abu Dhabi, in the way we have a limited course for the examination. See, this is for the limited and this is for the comprehensive examination. Okay, and if you see in Abu Dhabi dental coding, we have like a lot of codes. Okay, per specialty. For example, for the new patient or for the limited exam, we are having this code 01201. Okay, this one. Okay, so if patient is coming for the follow-up, okay, it is 01202. Then as I mentioned before, for the emergency examination, we are having, see this one, 01205. Then for the full mouth examination, we are having this one. Again, as per dentition, see, primary dentition 01101. For mixed dentition 01102. And for the permanent, it is 01103. Okay, and this below code you will find per specialty. For example, this one is for the orthodontic examination. They are using this one, 01901. Okay, for endodontic 01801, prosthodontic 01702, 701 and 702. So these all codes are according to the specialty, and for follow-up different code. Okay, so again, for when you are assigning the dental examination, you need to be careful again, as I mentioned before. For example, patient is coming just for the only for checkup and for limited exam, you need to assign 01201. If patient is coming with any pain or any trauma, anything, then it should be emergency. Okay, so if patient is coming for the for example for ortho checkup, so you need to assign this one. So again, what is important here to know is you need to know that under GP what code you can bill, and under specialty. Okay, so these code you cannot bill under the GP. Okay, maybe patient is coming to a GP and he has like tuk-tuk or he has like crowding or these things, and so what doctor will GP will do, he will just bill for limited and then he will refer that patient to the orthodontic. Okay, then the orthodontic, when he will examine again, he can bill this one. Okay, so one important thing here to know is same like E&M. Okay, same day you cannot assign to dental examination code. Okay, this you want to make sure that same day you cannot assign to dental examination code. Okay, so this is what I was talking about. Okay, so see, these are the like dental examination code used in Abu Dhabi. Okay, so full mouth examination, limited, recall, specific, and emergency. Okay, about the radiograph now. So what is happening when doctor need the radiograph? Okay, like for example, patient is having any pain in tooth and doctor want to see more in details, more depth of that tooth, what is in his roots and what is in the gums going on. So he need to take the radiographs. Okay, so in dental we have like like 4 to 5 different kind of radiographs they're taking. For example, bite wing. Okay, so what is happening? The first thing is when patient is having any complaint, so doctor will do the visual inspection. Okay, so he will examine. If he finds something, for example, patient is having just like minor caries, so he will see itself in a khalas, he will not take X-ray, he will just assign the code. But if he's having pain and he has like deep caries, then doctor will request for the radiographs. So we have different kind of radiograph, for example, bite wings, IOPA, then we have a tomography, we have OPG, we have the supplementary. So this different kind of radiograph he can request. So see, the most common used radiograph method for detecting caries lesion is bite wing technique. Okay, it means the fine lesion that are hidden from the clinical vision. So if doctor don't find, okay, with the visual examination, that's the time he will request for the X-rays. So these are radiographs using in the dental. So bite wing, occlusal, cephalometric, X-ray, OPG, periapical, and CBCT. So as I mentioned before, whenever doctor take any X-ray, so he need to write the findings and the reason of taking the X-ray. Okay, so this is important to write the findings in the notes. So these are the code assigning for the radiographs. Okay, so for each X-ray is different, like how many images they have taken. Okay, so see for the IOPA this code, for bite wing different codes, for the OPG this. So there are some guidelines here. If you see the right side, for example, for the OPG, panoramic X-ray is covered once a year. Okay, So in some cases, when the specialist really required, for example, for the prosthodontic or oral maxillofacial cases, okay, if you have justification, you can bill in that. If patient is coming with any trauma or something, he can bill this one, but as long as he can justify in the documentation. So these codes using in Abu Dhabi, okay, for the OPG 02601, for the bite wing 02141, for cephalometric 0701. Okay, so all this about tomography and about the IUPA. Okay, so this slide is about the prophylaxis codes. When doctor is like patient is having any like plaque or any gingivitis, so these are codes used in Abu Dhabi for example scaling, polishing, microabrasion, and this one. Okay, so when a patient is having any plaque or gingivitis or any periodontal disease, doctor will do the prophylaxis, and these are the codes. So this what I was talking about one slide, the unit of time. If you see this one, polishing and scaling, it's mentioned clearly 1 unit of time, 2 unit, 1/2, okay, each additional, okay. So according to the number of the units doctor bill, you need to add the time. And the time should be like, for example, doctor did the scaling for maybe for 45 minutes. Okay, so he will assign this code, scaling 1 unit. So he need to specify the scaling done with this and this instrument, okay, calculus removed. And then last he will write 1 unit from this time to this time, okay. So then again, for example, for the second unit, he can use again same thing, scaling done, second unit from this time to this time. So this is very important. Okay, so here is for Abu Dhabi, for Dubai. Okay, for American dental coding, so we have different codes. So if you see here, there are some guidelines again there. So they are having like a bundled code. If you see this one, periodontal scaling and root planning 4 or more teeth per quadrant. Okay, periodontal scaling and root planning 1 to 3 teeth per quadrant. Okay, so here if you see the guideline and payment rules, whenever scaling and root planning is needed, okay, D4341 and D4342 more than 2 quadrants. So see, these are per quadrant, you have different codes with a single visit. The following should be documented, submitted upon request: full mouth periodontal charting, OPG or bite wing X-ray. Okay, so if you see the solution requirement, full mouth periodontal charting. So you need to have a charting for this teeth when you are submitting this code, OPG or bite wing X-ray. Okay, so these are again in the most of encounters you will find in dental coding are these codes. Of course, like all the patient log, everyone is having these problems like caries. Okay, so mostly you will find are these encounters for RCT cases or restorations. Okay, so restoration, so we have 20,000 to 29,000 series for the Abu Dhabi. So you see, so this, in the earlier slides I was talking about the depth. So if you see this one, this is only on the like first surface of first layer of the tooth. Okay, this is more deep, and see getting deeper and deeper. So again, more the caries is deep, the code will be different. Okay, if you see on the right side, so you have caries in enamel. Okay, for example, this one. Then you have caries of dentine. Then into pulp. See, this is touching pulp. Then sometimes you are having the root caries also. So okay, so root caries. Okay, so according to the doctor, what his document, doctor what he see, first thing he need to write the correct documentation, and according to his documentation, you need to assign the coder need to assign the correct code. Okay, so these are the D series code for the restoration for the American dental coding. Okay, so D 2000 to D 299. Okay, so when multiple restoration for same tooth are requested or perform, multiple code should be used. It's not accepted to bill each surface. Okay, so for each surface you cannot use the different. For example, one tooth is having 4 surface, so you need to assign one code. Okay, you cannot bill like 4 times that code. You need to assign only one code. So for example, if the composite filling is done in buccal and occlusal surface, the provider should use the code resin-based composite 2 surface. Okay, so this is, see, he's having 2 surface, so you will use 2 surface code. All restoration, direct or indirect, should include tooth preparation, adhesive. Okay, so this is another like this one. So of course, local anesthesia, it is already included in the surface. Restoration provided to cosmetic purpose are non-payable. Okay, so some patient, they are having, for example, patient has like the different abnormal size of teeth, and they are having kind of veneers. Okay, so those kind of cosmetic things you cannot bill under the insurance. Okay, so restorative this one. So what is happening, like when doctors doing the filling, there are different kind of fillings. You have like a composite filling, you have silver, you have glass, and even some patient, they are asking, they are having the gold filling, silver filling, there are a lot of fillings. Okay, so if you see the guideline here, local anesthesia is usually considered to be part of restorative procedure. One surface posterior restoration is one in which the restoration involve only one of the 5 service classification: mesial, distal, occlusal, lingual, facial. Okay, so these are all the guidelines for this one. So as I mentioned before, if patient is having on the one teeth, he is having, like, for example, 3 surface caries, so you can assign only one code. Okay, so see, as I mentioned, like like different materials. So see, for amalgam you have different code. Okay, for the resin composite you have different. For the gold, okay. So according to the material used for the restoration, you can assign code according to that. So mostly you will find this one, the composite filling. Mostly you will find this composite filling code. Okay, so these are the codes. Again, guidelines almost same. Okay, so if you see here, you have for the. So yes, one important thing I want to tell you, like for the restoration. Okay, for the anterior tooth there is different code. Okay, for posterior, okay, different code. Or for the bicuspid, different. If you see this one, okay, first for example, so these are for the primary teeth, different code. Okay, for the permanent bicuspid, different code. Molar different, and for anterior there is different code. Okay, so you have to make sure that the coders, when doctor document, for example, patient has caries on a tooth number, for example, 6-7. So 6-7 are anterior teeth. So you will assign the code according to that, and he need to mention also. So there are like 3 things important: tooth number, okay, number of surface, okay, and the material he used. So these all things are important in documentation. According to that, you can assign the code. Okay, for example, if you are choosing this code 21223, for example, okay, so it's clearly mentioned restoration amalgam, non-bonded permanent molars, okay, 3 surface. So see, this is for the molar and this is 3 surface. Okay, so of course doctor need to specify the surface name and tooth number. Okay, about the endodontic. Yes, so when doctor is doing the pulpotomy, or RCT cases, so these are the like guidelines in the code for the endodontic. Okay, so one guideline here for the endodontic for the American is pulpectomy includes removal of the pulp, application of temporary filling. This is not to be constructed as a first stage of root canal. Okay, so for the RCT, of course, you are having 2 to 3 visits. Okay, so you need to be careful which code to assign when. Okay, for example, patient is first time he is coming just for the pulpectomy. Second visit he is coming for the RCT obturation. Okay, the last visit is coming for the final filling. Okay, so you have to assign code according to that procedure code. Now let's talk about the diagnostic code for the endodontic. Okay, so when the patient is coming for the complaint, for example, patient is coming for the pulp necrosis. Okay, so from first to the last visit, you will continue the same diagnostic code. Okay, for example, patient is again coming for the dental caries into pulp for the RCT. Okay, So doctor already removed the caries in the first visit. Okay, he put the temporary filling. Okay, and he asked to come back after 2-3 days for the RCT. Okay, so in the next visit, second visit, again he will assign the same code. Okay, same code, but only the chief complaint, it will be the continuation of the endodontic treatment. Okay, this is important because some coders are confused that they are saying, okay, patient don't have any more caries. Okay, caries is removed in the first visit. Why we have to assign this one? For RCT cases, you have to continue the same codes in the all from start to end. You have to use the same diagnostic code. Okay, there are some more guidelines for this one. Okay, so this one, if the patient did not complete root canal treatment or patient didn't show up to complete the treatment, provider should submit code. Okay, see, so what's happening, sometimes patient is coming for RCT case and he just did the pulpectomy and maybe he go to the doctor or maybe he just don't want to continue treatment. So you cannot assign that for the code for the RCT. You need to only assign this code D3221. Okay.
Check.
Endodontic treatment includes local anesthesia, canal preparation, intracanal medication. Okay, so this everything is included. You cannot bill separate for all these services. You have to assign only this code. Okay, okay, D7510. Okay, so endodontic codes should match the tooth description, not number of canals. Okay. So this is one of the, again, one difference in the Dubai and Abu Dhabi is in Abu Dhabi we are having like number of canals. According to that, we have to assign the canals. Okay, here if you see tooth number 8, we have different, bicuspid different, and this one different. Okay, so some more like guidelines here for submission. So pre and post-operative peripheral radiograph with detailed chart note detail regarding necessary of the procedure. Okay, so pre and post-operative periapical X-rays you need to have. Okay, same thing is in also in Abu Dhabi. So they need to take the X-ray before and after. Okay, then chart note outlining necessary of the treatment being done, including diagnosis, including any additional diagnostic. So what is important? You need to have the complete documentation, charting, X-ray, everything you need to have in your notes. Okay, so these are the code we are using again in the Abu Dhabi. Okay, so 3 series code. So again, these are also as per tooth number and per canal also. If you see this one, this is anterior, okay, molar teeth. Okay, so if you see this one, according to the canal. Okay, so doctor need to mention the number of canals, tooth number. Okay, so this is the important part in the for the RCT. We'll talk about now the periodontal diseases. Again, I discussed before for the scaling, polishing in this one. Already discussed in the earlier slide. For the prophylaxis, okay, they can for Dubai we can assign only one code like this bundle code. So if you see one guideline here, procedure is a benefit of in the pocket depth in the greater than or equal to 5 mm. Okay, this is about gingivectomy. Okay, so it's limited to the 1 per 4 years in one oral site for mentioned above 12 years of age. Okay, so you can bill only 1 per 4 years. Some more guidelines for the periodontal. Okay, so this is about the splinting. Okay, not covered for member less than 12 years of age. It is covered once per quadrant per year. Okay, this is about the splinting. Okay, about the periodontal maintenance. Okay, so periodontal maintenance code patient with chronic periodontal disease. It can be utilized 3 months after scaling and root planning, and requires submission of the periodontal chart, biting X-ray, and OPG reflecting the. Okay, so these all things we require when you are billing this periodontal maintenance. Okay, for the Abu Dhabi again. Okay, so we have scaling, polishing, root planning this course. As I mentioned earlier, that we have like for some of the like time-based code. Okay, so some are for sextant. Okay, if you see here per section, for example, gingivectomy, frenectomy. So these called surgical curettage. These are sorry for the gingivectomy and the curettage. We have per sextant. Okay, so sextants is actually like 6 teeth. Okay, so they're like counting 6 teeth. Okay, interior, then on the right and then left, and then same for the lower. Okay, so make sure that, for example, patient is having the like gingival enlargement in the front 4 teeth. Okay, so you cannot build this 4 times. You have to build only 1 time. Okay, because this code is per sextant. Okay, so this is very important to know this point. Like, you cannot assign this code multiple times. Okay, for same sextant. This is per sextant. Okay, so make sure that you have to know the tooth numbering for the per sextant, which tooth number. So then you can assign this code. So recently there are some updates about this one. Before GP can bill gingivectomy. So just make sure you have to know that updated scope of service. Okay, so if the GP can bill or no, because I think now in Abu Dhabi, okay, only periodontist or specialists, they can only bill this kind of surgical procedures. Okay, about the prosthodontic. Okay, in the prosthodontic, we are having multiple procedures, like for example, implants or the dentures, bridges, crowns, all this. Okay, so again, so these are high value procedures. So you have to be careful with the diagnostic code, procedure codes, tooth numbering, okay, approvals, all things you need to be careful. Okay, so diagnosis we are using for the missing tooth are K08 K series, again K08. Okay, so you have to be careful when you are assigning this code. Okay, so missing teeth, basically if it is complete missing teeth or partial. Okay, now here also some code they are having confusion about the complete missing teeth or partial. If you see the code description, it shows that it's not some code they are taking one tooth, maybe patient is having caries and one tooth is lost, completely lost, or only part of that come under different caries, right? So missing teeth, this code we are taking for the missing, complete missing. Okay, when if I have one, for example, this one. Okay, so this is missing teeth in one quadrant or one teeth only. So this we take as a partial missing teeth. So it is basically per, you can take this one as per arch. For example, patient is having two tooth missing in upper arch, okay, and the complete from the lower. So you can assign both codes, K08.4 or K08.1. Okay. So what is important here? You need to specify the classes. Okay. Kennedy classes you have to specify. From the X-ray itself, you will know from what classes missing teeth means. Okay. So you have to specify. Doctor need to specify that patient has missing teeth class 1. Okay. According to that, you can assign the code. So see, so these are these series, D5 series for the dentures. So some guidelines are here for the prosthodontics. Okay, each retainers and each pontic continue the, okay, so bridge, you cannot build only one pontic or one this one. So this is set of codes. Okay, pontic and retainers is a set of codes. Whenever you are building for the bridge, you need to have the both codes. Okay, so local anesthesia is usually considered to be part of. So local anesthesia you cannot build separate. So this is included in the services. The term fixed partial denture replace the word bridge. Okay. Okay, so fixed partial denture, now they are this is bridge and bridge work. Okay, classification of material. Okay, so again, whatever material you use in that bridge, you need to, again, there are code according to the material. So you need to be careful. Is it porcelain or it is, what kind of material is used? It's metal or porcelain. Okay, so you have to, doctor need to document that use material. So according to that, you can assign the code. Okay, then again for the implants. Okay, for implants we have this fixed prosthodontic. Each retainer, and okay, this is same, I think. Yeah, so this is almost same slide. Okay, so this is about the Abu Dhabi, the Canadian dental codes. Okay, again we have different like denture codes. Okay, complete, partial. Okay, so again what material is used. Okay, and for the maxilla, for mandible. So this is very important to know the which arch. Okay, for each arch we have different maxillary or mandible different code. Okay, it is partial or it is like, so see a lot of codes. So you need to be careful. Okay, so according to the doctor's documentation, if you find any like any doubt, you need to query the physician to know, okay, the material used in that thing. Okay, for crowns or for dentures, you need to, the doctor need to document clearly. Okay, so these are like again the codes used for the fixed denture or removable. So again, this one for the bridge. Okay, so what's happening? You know, sometimes the doctor they are putting this code for the only one alone code for Pontix, for example. Okay, so if you are submitting this one, you're sending the approval. Of course, they're not approve unless you have the retainer code. So make sure you have a set of codes also. Okay. So again, this one again, if you see this one, this is prefabricated, cast metal, porcelain. Okay. So tooth number and the material used in that one. Okay, you have to know that one. Okay, about orthodontic. Okay, so as I mentioned for the ICD, we are having M series code. If you see here, malocclusion or crowding, spacing, all these ICD codes are coming under the M series code. Okay, in the procedure code for again for Dubai, we are having this code 0D8 series. Okay, so we see this code. So coverage of this code is limited to the member who have orthodontic plan benefits. This is the first thing for the payment. Okay. And for the submission also, like for the bonding, there are different codes. Okay, for the monthly visit we have different. Okay, same for the CDA, American Dental Codes here in Abu Dhabi. Okay, so again the ICD are same. The procedure for bonding. Okay, so again the bonding, you know, like there are different codes for the according to the class. Okay, so the doctor will document after the measurement. He will document the patient as a class 1. Okay, and he's going to do for the class 1 malocclusion in this one case. Okay, so code, see if you see 84201 and these codes. So these all codes are for the case type 1. Okay, for the permanent dentition. So these all codes. So we have different category codes. So if you're in the right side, so some guidelines. Okay, so don't bill 9,222 with appliance. Okay, so if the doctor is putting any appliance in the monthly visit, you cannot bill with the monthly visit. Okay, don't bill bonding. Okay, sometimes what's happening, you know, like again some new coders, they are not aware about this one and they are billing the bonding code with monthly. That is also not acceptable. Okay, another thing is don't bill 9,222 within 21 days. Okay, so you need to know all these things. So like especially for the monthly visit when the patient is coming, you need to be careful with these guidelines. Okay, about the general anesthesia. Okay, in the many slides I mentioned that most of like it is already included in that service. Okay, for restoration, for RCT, we cannot bill separate the anesthesia. Okay, so physical anesthesia should be preferred whenever possible. The benefit of risk of general anesthesia should be considered technician. So letter from the practitioner to the anesthetist with the detailed indication general anesthesia. Okay, then this is for actually for the GA. Okay, pre-anesthesia consultation. Okay, then you know in the GA cases, so what is happening, like you know young children if they are uncooperative, so who cannot do in the OP, so they are referring them to GA. In the GA they are like have to give them the anesthesia to for the treatment. Member should be young with the dental condition that require repair of significant complexity, multiple amalgam. So for this thing, when this GA cases, you can build this one for the anesthesia. So see this one. Member physically mental or intellectual or medically compromised. Okay. So for the GA cases, we are using this anesthesia code. So these are the codes we are giving for anesthesia. Okay, we'll talk about the coverage. Okay, again, like insurances are having the basic plans or the enhanced. Okay, so when the like front desk staff, they are registering the patient. Okay, they have to register correctly. Okay, from there itself, when the patient is visiting the clinic, the front desk, they need to know that the coverage is there or not for dental. Okay, because when the patient comes, they have to inform them if it is self-pay or it is plan is covered or no. There are like multiple, like lot of cards like basics or enhanced or gold. So all these SOPs, the front desk also need to know, so that they know in that itself they can tell that this is covered or no. Yes, of course, for the emergency cases, of course, they have to accept all the patients. Then we can discuss about these things. So if you see this one, dental services are not covered for the basic products. Okay, except in the case of emergency. Table of benefits. Okay, reimbursement basis on the payer and plan basis. Waiting period, co-insurance. Okay, so these are all the coverage things. Okay, about this one again, the guidelines for the coverage for the Dubai. Okay, orthodontic treatment coverage for the core is limited to the member who have orthodontic plan benefits. Okay, so same here in Abu Dhabi also, like only like for example, Thika card is covered for the orthodontic. Okay, for the others, it is like some cards only they are covering some like basic services. Major dental surgeries. The following surgeries include necessary local anesthesia, removal of excess gingival tissue, suturing, and one post-operative treatment when required. Okay, and the radiographs. Okay, this already mentioned in the radiograph page that this code D0210. Okay, initial X-ray for any dental treatment can be billed separately. Other X-ray taken during treatment is part of the procedure cost. Okay, so some X-rays are already bundled with the procedure itself. If you see this one about the again the OPG, the non-X-ray is covered once a year. Okay, then the sphelometric. Okay, coverage for this procedure is limited to the member who have orthodontic plan benefits. Benefits for the sphelometric film performed with the service other than the orthodontic treatments are denied. So these are for the Abu Dhabi, again for orthodontic treatment. Orthodontic treatment cannot be covered as routine dental examination. It can be covered for more than once per case per provider. Okay, so of course they need the prior authorization. Okay, for the orthodontic treatment. And now in Abu Dhabi, they are having like second opinion also. Okay, because when some patients they are like sent for second opinion, then doctor will decide that like what kind of treatment they need for the orthodontic. Major dental surgeries. The following surgical services include necessary local anesthesia, removal of excess gingival suturing, or once post-operative treatment. Dental radiographs are not covered for insurance without the optional dental benefits. Okay, so see if you see about the X-rays. Okay, once per year also here. Then this one occlusal X-ray is not covered. This there are no more billing. It's not covered. This one. Okay, only unless it is like oral maxillofacial for the tumors or the any like stones in the salivary glands. The bite wings is covered in case of dental caries for posterior teeth. Okay, provided that tooth number is mentioned to detect the pocket. Okay, so now this code is like if in case as I mentioned before, patient is having pain and doctor is taking the X-ray, but maybe in the X-ray he don't find any caries. Okay, so that time in case the claim is rejected, your coder need to resubmit this one. You can tell that patient was having the severe pain and doctor took this X-ray to make sure if there is no caries. So you can resubmit this bite wings. So maximum of the 2 can be paid for an examination. Periapical X-ray is limited to the maximum of 2 for restoration, 4 for RCT, and 8 for full mouth examination. Tomography is covered for implant cases. Okay, so tomography, okay, this is only limited to the orthodontic or prosthodontic. Okay, so there was question about what is the code for clear aligners such as clear, correct, Invisalign. So there is no unique procedure code for such devices, orthodontic devices, and are documented based on the practitioner's patient diagnosis and treatment plan. Okay, so about the aligners, there is no code to assign. Ortho procedures code, which one? First, determine the patient stage of dentition. Okay, as defined in the orthodontic category of the service descriptor. Then plan of type of orthodontic treatment, limited, interceptive, or comprehensive. Okay, then select the dentitions. Okay, specific procedure code is applicable, so you have to know the codes. For example, use D870 to report periodic treatment visits. Same, like what we're using for the Abu Dhabi 9332. So D8670 for the monthly visits. So these are some requirements they need for to get approval for the orthodontic. Okay, they need to attach the OPGs, digital photos, assessment forms. Sometimes they need the medical reports also. Okay, so consultations is when the dentist A refer a patient to dentist B for an opinion or advice on a particular problem. Dentist A would report the period oral evaluation code. Okay, dentist B would report the consultation code. Okay, so this is about the, again, for the American dental coding, we have the consultation code. Okay, during a periodic oral evaluation, if patient shows sign and symptom of periodontal disease, how to report? So you can report this code D0180. Okay, so question was, are a panoramic film and whitening considered a full mouth series radiograph? So answer is no. A full mouth series, okay, is defined as of D0210. This is for the complete series. A set of intraoral radiograph usually consists of 14 to 22 periapical and posterior whitening images intended to display the crown and root of the teeth, periapical areas, and alveolar bone crest. So when mechanical enlargement of occlusal pit and fissure is performed in conjunction with the placement of dental sealants, this preparation step is not reported separately. Okay, so the reason is D1351 sealants per tooth described to the preparation step, mechanically or chemically prepared in enamel surface seal to prevent decay. Sealants are usually applied when there is no decay. Okay, so sealant code, you can even, for to support this one, that code also support the sealants, because patient is not having any caries, right? It's only they're just putting like sealants in the fissures. Okay, so you can assign this code D1351. When decay that does not extend into dentine is present, another procedure code is appropriate. So we have again the preventive lesson D1352. Okay, so this I discussed earlier about the two surface restoration of same teeth. But two separate surface restoration in the same teeth report the procedure as performed D2150 twice, once for the MO and second for on the same tooth. Okay, so you have to know the insurance coverage. About the crown, what procedure code is used? A porcelain fused to the zircon crown. Okay, so the available code we have is D2740. Okay, for porcelain. And how is the porcelain fused to titanium crown? Okay, this one titanium. For titanium, we can use this code. So see the different material and different code. So you have to, daughter need to again specify the material, what material is used in that crown. Then according to that, you can assign the code. Okay, implant and Pontic. Reporting a fixed partial denture placed on implant. How do I report Pontic? Okay, there are no Pontic codes in the CDT implant service category. Pontic code is prosthodontics. Fixed category are used for both fixed partial and implant supported denture. All Pontic codes beside begin with the D62 series are used with the appropriate implant or this one, the written report. Yes, so this was like a question, for the partial extraction. Even in Abu Dhabi, some doctors, sometimes they are asking if the doctor is using only the crown of the teeth, okay, how they can like coronectomy, okay. So here, is there any code for partial extraction? The doctor removed most of it, but was unable to remove the entire tooth, and the patient was referred to an oral surgery, okay. So the only partial extraction code is D7250. Unfortunately, in the Abu Dhabi, we don't have the coronectomy code, okay. So only they can bin only if the complete tooth is removed. Okay, in Abu Dhabi, we are having like extraction, simple extraction, or remaining root extraction, or impacted tooth extraction. Okay, but unfortunately, we don't have this coronectomy code in the Abu Dhabi codes. Okay, so some guideline for the Abu Dhabi. So again, same thing, scaling and washing the start and end time we need to document. Okay, so mostly like there are a lot of codes for the start and end time. Okay, scaling, washing, microabrasion, palliative, this one. So whenever doctor bill any time-based code or resegmentation, for example, you need to specify the start and end time. Okay, so recently there are some updates for the scope of service in the Abu Dhabi. Okay, so you have to go through those, okay, all those new scope, okay, because now like the same before GP, they can bill, for example, gingivectomy and some like kind of things like implants and this one. So now you need to read very carefully that some of those areas, okay, they need to have the privilege, for example, for the implant and this thing, and some they cannot do anymore. They have to refer that patient to the specialist. Okay, so you have to go through all those scopes of service, okay, and then you need to inform your doctors. Okay, so that's from my side. Thank you so much. Any questions?
All right, thank you so much, Mr. Basharat. That's very informative sessions. Now we are open for Q&A, for question and answer. So this is your time, guys, to ask directly regarding with the topic that we had. Let me just unmute. Hold on. You can actually raise your hand, or you can also type your question in the chat box if you have question. So I think we have one, Shakila.
Hello.
Yes,
Yes,
madam.
we can hear. Yes, we can hear you. Go ahead.
Good morning, Dr. Basharat.
Yes, madam.
I have a doubt. What about the palatal surface? You can mention any palatal surface in the composite filling.
Okay, you are talking about you are from Abu Dhabi, right?
Dubai.
But yeah, see the palliative about for the when you are having any procedure, for example, you are having RCT, right? You are having
Yes.
RCT, and the palliative service is actually for the pain, right? So if you already have that procedure you are doing in that, so then you cannot assign the palliative code.
Sorry, I'm asking about composite filling, palatal surface.
Sorry, yes, palatal, yes, okay. So what is your question?
No, you show that paper, right? There is no palatal surface is not mentioned.
No, it's actually that is only I put the palatal is also like smooth surface, okay. So palatal also like, okay, so your question is like it's not mentioned. Yes, palatal, see those are only the name of the surfaces, okay. Palatal, so they are like like for example the mesial, distal, lingual, also whatever surface is there, you can bill according to the number of surfaces.
Okay, thank you. Next thing, that is that for 48.02, you told me to bill for the checkup, right? That we can mention as a primary code.
Sorry, which one is that?
48.02.
No. Yeah, see, I will tell you this code, because anyway you are not going to bill any procedure and examination code, right? If it is only the recommendation and the suture removal only, yes, you can assign that one alone only. Okay. But in case you are having, maybe this patient is coming in the visit, and this visit is having other treatment also, and same time suture removal, that time you can assign other codes, and this should be the last one. But in case patient is coming only for suture removal and no more billing, you can assign this one only, alone only.
The patient is coming only for orthodontic checkup, that plate adjustment and all. We can put directly this code, or we need to put malocclusion code along with this. 46.3.
Z46.3, yes. Okay.
Yeah.
See, so yes, so that code is patient. So you have to assign whatever code is coming for the occlusal adjustment, right?
Yeah.
Yes. So you can assign the. See, if the patient is coming occlusal adjustment, it means he has some unsatisfactory restoration or something, right? You can
Sorry, sir.
assign the.
I am asking
Yeah.
about orthodontic plate adjustment.
Okay. Yes. On that case, you can assign one of the orthodontic code, whatever the initial treatment was started, and then you can assign Z46.3.
Okay. That's but one more question about the orthodontic treatment. In Abu Dhabi, there is orthodontic consultation code is there, right? 190.
Yes.
But Dubai, there is no code for consultation. Which code we can use for consultation?
For Dubai, yeah.
Yeah.
Yeah, I will just send. I will send you that one. I need to open the list, and then I can send you. There is one code for that for the.
No, before that description is changed now. Now they changed to growth and development.
Yeah, I need to check that, and then I will send you that code for examination, right?
Yeah, orthodontic consultation.
Yes, see what is happening, like for the orthodontic consultation. See, if the patient is coming for the first time.
Yeah.
Okay. That is including that, like when you are sending for the orthodontic braces and the bonding code, okay, then you can assign that examination code with the bonding. The code itself I will send you. I will look and I will send you.
Okay, last question. That partial denture we can make as D5211, right? That additional tooth we can add along with that, or all the tooth is included in that? Because S is there, teeth is there.
Yes, see that the denture, like is again denture, like he make for one teeth or two teeth or three teeth. Okay, so it depends on the like he make for one teeth or two, because the denture is itself from the lab made, right? They'll make from the lab. So what you cannot build separate.
No, that insurance is not allowing to build separate add-on additional tooth.
No, this one
no 5650 is not allowing now.
Okay, I need to look in that. Okay, but denture itself, like they are like you cannot build separate. It should be one only.
Yeah, that's why. If one teeth is also same price, 10 teeth is also same price.
Yeah, see, if you have, just send me this one. I will just also I will answer you soon from the new guidelines.
Thank you, sir. Thank you for the information.
All right, thank you. We also have a question here from the chat, Basharat. Can you answer it? This is from Shuprita. Till what age we can use primary dental codes?
Okay, so okay, so this one, see, as long as patient is having even one teeth in his mouth primary, okay, and you are examining their primary tooth, okay, then you can assign. Okay, but see, the primary is like if you are doing only that examination for that tooth, then you can assign primary. But if patient is having the multiple, like like both, better to always assign the mixed dentition examination code. For example, patient is coming with for this visit, he's coming only for tooth number A is still there. Okay, so maybe he's going to like extract or those sorts. So you are examining only that tooth only. Then you can assign only for that one. But if you are doing multiple procedures on this visit, and okay, you have the mixed dentition, so that time you can assign the mixed dentition code.
All right, thank you. And other questions? Can we have a soft copy of this power presentation, your presentation, Basharat?
Yeah, sure, yes, you can share with
okay me. All right. And next, can we code, this is from Javed, can we code 42111 and 49211 together in a claim?
That I think it's irrigation code, I think, but I don't have the list now. So if you can specify more, I think if it is irrigation or route planning, you cannot bill together.
All right. Okay. So a follow-up question from Javed. Pulpectomy can code with TF?
No, we cannot bill this one.
Okay.
This is
So
under, yes.
okay. So last question from the chat. This from Naeem. Hello, sir. Can you please repeat for Abu Dhabi? Number 1, what code for partial extraction? Number 2, which condition cannot be billed under monthly orthodontic follow-up?
Yes, okay. So can you repeat the first question, what he mentioned? First question, extraction, partial extraction.
Yes,
So
partial extraction.
Yes, okay. So now my question is, he mean to say that like coronectomy or something. See, partial extraction we have only like I'll tell you 4 codes. Okay, if you can write down, it is simple extraction. Okay, so if you're talking about the one teeth and he removed just only like part of teeth, we cannot bill anything. Okay, only if the patient is having root, for example. So we have the code for the removal of the remaining root. Okay, there is code. If the patient have the impacted tooth, we have different code. If it is simple extraction, we have different. But only the same tooth is removing only the crown, coronectomy. We don't have code in the Abu Dhabi, but Dubai we have. Okay, but in Abu Dhabi we don't have that coronectomy code. Okay, the other question.
The second question is, which condition cannot be billed under monthly orthodontic follow-up?
Yeah, see, the monthly orthodontic, for example, is patient is coming for any repair. Okay, repair codes you cannot bill with the monthly. Other things are appliances. Any appliances, okay, when the doctor is giving any appliance, okay, even if you see the code description, it will show appliances. Okay, any appliance code with monthly you cannot bill. Okay, if he can just send his email, I can send him the codes.
All right. Okay. Let's have 2 more questions, and if you have other questions to our guest speaker, we will also share his email address or WhatsApp number, so you can actually email or ask directly to the speaker. Okay. We have last 2. As per new circular release by DOH, can a GP with implant privilege do the implant placement? Is it a question?
Yeah. If you read this, that's why I told all the coders and all the clinic like this one, the admin team, they need to read this new circular very carefully. Sorry, because like now, like most of services, like specialist things, for example, gingivectomy, frenectomy, and this one, the implants and the pedo, all this one now they are most of this one they are asking to refer to the specialist. But your question is about this one. So implant, yes. If you see in that category, they mentioned that if the GP has the privilege, then of course he can do the, like they're different. Like there are some services they need the like privilege, some they need the training. So for implant itself, they need a privilege. And if you see the criteria for to getting privilege, that is also you need to get that one.
Okay. All right. Thank you. And for the last question, for Abu Dhabi ortho, can you elaborate on billing for emergency ortho recementation? Like how many days should be the interval from monthly visit and adjustment?
See, for the monthly visit, we are having 21 days, right? 21 days. After 21 days, they can bill for the monthly orthodontic. Okay. But for example, patient is coming he is having any appliance, and in between those visits, if he is coming with the broken appliance or something, that time you can bill, okay, for the like repair code, okay. But okay, don't make this practice, because monthly visit is already like like in the audit or the month they can question that why you are having a lot of like repairs in between, because of course like okay, once in a while if the patient is having any broken appliance you can bill, but not for every patient or every visit.
Okay, thank you so much, Mr. Basharat. We actually have some other questions here in chat. So what will I do is I will just collate these questions and I'll be forwarding this to Mr. Basharat, and then I will be providing you the answer directly from him, or you can actually message him directly with regards with your question. Okay. Again, thank you so much, Mr. Basharat. And before Yes, thank you so much. Do we have Sir Kushal? Can you present the speaker certificate?
Sure, Beverly.
Hmm.
Thank you so much for today's session. I think from a clinical aspect and from a coding aspect, I think this session was very well done, and I believe the coders they should really should have paid attention, and it's a really wonderful session. You provided us with the clinical scenario, what how the patient presents to the facility, and how the coder then has to interpret things. So thank you so much, and I would like to present this certificate of appreciation for being our guest speaker today, and for this wonderful session today.
Thank you so much, Mr. Vishal.
All right. Thank you so much, Mr. Basharat. And hopefully we want you to be our guest speaker in the future also again.
Yeah, sure.
Okay. Sure. All right. So before we will end we will end the session. I think everyone really waiting for this. For the what is this? The CEU. But before we provide the link and the QR code, Dr. Kushal, do you have any closing remarks for our members? I believe we also have other members joining from other local chapter like Abu Dhabi, and I think we have other local chapter from India and Philippines as well.
Yeah. Yes, Beverly. So, guys, thank you so much again for joining today's session. And I can see we had, close to 450 attendees today. So, again, massive thanks for taking out your time today and participating in this continuing of education. Looking forward for multiple sessions in the coming month. And more importantly, looking forward to meeting you guys in person. I think we have a lot of coders in the past couple of years that have been certified, and our community is growing. And obviously, we're looking forward to collaborating with multiple speakers and attendees from all over the world. And guys, thank you so much for coming today.
All right, thank you so much. And again, I already shared the QR code for the CEUs, and I also pasted the link in the chat box. Please try to either join either the QR code or the link. And for the CEU guys, please be minded that it will take some time, like a 1 week time, to be credited in your AAPC account. So again, it will be automatically added in your AAPC account. Hopefully, there will be no problem in regards with the accreditation of the CEUs, because the last time, I think for the last 2 sessions, we're having a problem because of the updates in the system of the AAPC. So again, please bear with us. Kindly wait until this week for the CEU accreditation. And again, you will be only having the CEUs if you will join the meeting, because we often see some members are only registration for the CEUs but not attending the meeting. Okay, so is everyone seeing the QR code? Let me know if you have okay, I also pasted the link again in the chat box, and please do not share it with those members who are not here in the meeting. Okay, so please okay, now please be minded to put carefully your full name and your AAPC member AAPC member number, because this will be the one that we will be uploading and submitting to the AAPC account. Okay, I can't see the QR code. So if you cannot see the QR code, please, here is the link in the chat.